Hello, and thank you for joining us today. This has been an extremely exciting year here at Lympha Press. We've been involved in more clinical research, we've reached and helped thousands of patients, and we've been involved in education, both with our medical community and patients. Lympha Press is currently used in over 37 countries around the world, and we have a long track record of being established and used for the treatment of lymphedema for nearly 40 years. Lympha Press is an at-home treatment for lymphedema. It's pneumatic compression, which means this device can be used for an hour or two at home to manage your condition. It provides dynamic compression to move fluid out of the affected area. We understand how challenging lymphedema can be. That's why at Lympha Press we support lymphedema education for patients and the medical community. Exercise is an important part of self-care. Watch this video to learn more.
Hi, I'm Karen Ashforth. I'm an occupational therapist and a board-certified lymphedema therapist. I'm here today to talk to you about lymphedema and exercise. Exercise is very important for people with lymphedema because the lymphatic system relies on two things for circulation, on valves and muscle contraction. So really, any kind of exercise is going to help the lymphatic system. If you're going to start a new program, I recommend that you speak with your doctor and start slowly and gradually add time and resistance. Many people like to walk because it's a very simple and easy and inexpensive exercise. And for those who have upper extremity issues, using Nordic poles can actually help the workout. In the past, there's been a lot of controversy about exercise and lymphedema, and people have been afraid to exercise. But there's been a lot of evidence that has shown that even weight training can be beneficial for people with lymphedema as long as you approach it gradually. I would have to say, hands down though, the best exercise for people with lymphedema is water. Using underwater, deep water exercise adds external compression that, paired with muscle contraction, creates an ideal environment for lymphatic circulation. When you consider that for every foot of depth of water, you're gaining almost 23 millimeters of mercury compression. At a depth of 5 feet, you've got 100 millimeters of mercury compression. And it's going to feel a lot more comfortable than wearing a compression garment because the water conforms around the body. Doing exercise in waist-high water is not going to be quite as effective for those with upper body. You may want to do some additional exercise before and after where you're in deeper water. So some things to be aware of and to be cautious of are if you have a depressed immune system because you've had recent chemotherapy, or if you have fragile skin as a result of radiation therapy, you want to maybe hold off until things are a little bit more healed. And if you have an open wound, be very, very careful. I would avoid going in the water until your wound is healed. I would advise anyone who has fragile skin to do a skin check after being in a pool and use a mirror to look at the backs of your legs. If you have any open wounds after you get out, you want to be playing it safe by putting on some topical antibiotic ointment. I suggest using flip-flops in the locker room, and if the bottom surface of the pool is rough, you may want to wear water shoes to protect the soles of your feet. If you're doing exercise in an outdoor pool, it's a good idea to wear sunscreen, and you can even wear sunglasses and a hat or protective clothing such as a wetsuit or other types of upper body clothing to protect your body on hot days. Some people like to use hot tubs to exercise in, but you need to be very, very cautious about using a hot tub if you have lymphedema. A lot of people think that if you leave your arm or leg outside the hot tub, it's okay. But the hot tub will actually raise your core body temperature, which could potentially cause swelling in your lymphedema limb. So my advice, especially if you're going to exercise, is to turn the temperature way down, and that way you won't run into problems. To sum it up, any kind of exercise is good. Water is best. Movement is life. Keep moving.
I could sing you the praises of Lympha Press all day. It's really made a big change.
Every night I leave it on for an hour while I watch TV or read and take it off in an hour, and I've got a skinny foot and an ankle. And it doesn't hurt in the morning when I get up.
I use the Lympha Press once a day for an hour. The optimum is 2 hours. If 1 hour is done what this has done, think of what 2 hours will do.
The pump allows you to kind of recalibrate. You get the leg back to a state where it doesn't hurt that much to get up and walk, and now you can start to exercise, and that improves the situation all the way around. And then you maintain that by using the pump several times a day while you're relaxing. You're reading a book, you're watching TV. I always tell them, slap it on, push the button. It's no big deal. It kind of feels good anyway. And patients tell you that. They like it. They like the way it feels. It's kind of like a massage.
Oh, it feels wonderful. The difference between my legs using the pump and not using the pump is 180 degrees.
Since I've been using Lympha Press, it's been, I would say, 100% improvement.
This day and age, with the technology that's available, venous ulcers and lymphedema can be addressed, and they can be addressed successfully, and there's absolutely no reason for you to have that misery on your leg.
Once you have it, you realize how it's changed your life, and it's changed it so much for the better. It's the pain that it's taken away and the comfort that it's given. I don't know that you could put a price tag on.